Globalized area studies, what's different about it? Well, traditional area studies has been criticized for being too parochial. And in today's globalized world, parochialism doesn't cut it. It's important to combine local contextual knowledge with a global and comparative vision.
The conditional cash transfer programs were a new model in the mid-1990s. They started concurrently in Mexico and Brazil. The idea behind them is to give direct cash benefits to poor families conditioned on visits to healthcare services or educational classes, training. And from when they were first implemented in the mid-1990s, they have become the sort of best practice for poverty alleviation, certainly throughout Latin America, but arguably across the Global South. One of the questions that really motivates my own research is thinking about how these models come to be best practice, given the reality of persistent poverty, of persistent inequality across all of these regions.
20 years ago, I think it was impossible for people to argue for a different approach to drug trafficking, since President Nixon declared the war on drugs.
We must wage what I have called total war against public enemy number one in the United States, the problem of dangerous drugs.
And I think right now, partially because of the violence that is happening in Mexico and different trends in Europe for different approaches to drug consumption, has created a great opportunity to debate drug policies more openly.
So what you try to do is build some bridges across regions. You also build bridges, and this is something that the Watson Institute is known for, between scholars and practitioners. How do you know the difference between a scholar and a practitioner? Well, it's pretty simple, right? Scholars always ask, well, that's great in practice. How does it work in theory? And the practitioner asks the opposite. That's great in theory, but how does it work in practice?
The conference I'm co-organizing with Rich Snyder is called New Approaches to Poverty and Inequality Alleviation in the Global South. And it is organized around talking about the politics of the design and the implementation of these sort of innovative programs, but also the political effects. In bringing together representatives from Mexico and Brazil, India, Turkey, and Indonesia, we thought we would be able to spur a cross-regional conversation about poverty alleviation models.
The conference Drug Wars in the Americas is an opportunity to think about the past, present, and future of drug policies.
One thing we'd love to explore in the conference is this idea of conditionality, the conversation of whether benefits for the poor should be conditional or not kind of dropped out. And we'd like to talk about the possibility of universal programs, a universal minimum wage, for example.
People disagree on to what extent drugs should be legalized or decriminalized, and that's the kind of discussion that we want to have in our conference, like what are the different possibilities, what is the feasibility of changing, what the future will look like.
What does effective leadership around drug policies entail? What characteristics would such a leader have? What communication strategies might be most effective in raising public awareness about the alternative policy options? Why does globalization seem to increase inequality? Why does extreme poverty persist in the face of such global wealth?